You again. Today we are going to learn about lymphedema. We all know that what is lymphedema and which system is related to. So this is related to the lymphatic system. Before moving on the session, I want to know how many of you have seen lymphedema at least once. Please put your answer in the chat box or you can unmute yourself and talk. Any answers? Okay, or no, or your boy have seen anybody else? Only one person's have seen lymphedema. That is too bad. We all nurses during the study period at least we have seen these kind of edemas. Definitely, we have a oncology posting there. So that time, I think you must seen a lymphedema patient there. Anyway, so let me share my screen. So I hope my screen is visible to everyone. So as I already mentioned, this is related to lymphatic system. We all know that lymphatic system, all of is a part of the circulatory system, and it flows through that lymphatic system or more everywhere. That lymph will be flowing. Okay. So before moving on the lymphedema part, just think about lymph. What is lymph? Lymph is a tissue fluid or an interstitial fluid is collected through the lymphatic capillaries. Okay, where that lymphatic capillaries is situated. You have to think about that. And after that, that fluids enters into the lymphatic vessels. Then it goes to the lymph nodes. Finally, it goes to that subclavian vein through. Then if there is a subclavian, that lymph flows to the subclavian vein, definitely it's a subclavian vein is a part of circulatory system. So that is how that lymph is flows. So here we need to understand that lymph is a tissue fluid, is an interstitial fluid. Okay, and also we need to understand that wherever the lymph is collected, the lymphatic capillaries will be absorb the fluid from the lymphatic, that interstitial space. Okay. What are the functions of the lymphatic system? So I need your answer. Please put your answer in your chat box. What are the functions of major functions of lymphatic system? Anybody? At least one function you must tell. Can you hear me? Okay. Yeah. Okay. So managing fluid levels in the body, protection, maintaining body fluids. It helps to maintain our body, correct the fluid volume. Very good. Managing fluid level again. Maintaining body fluid. Okay. Maintain fluid level. Absorb fats. Absorb fats. Where? Shiny said absorbing fats. Where? Intestine. Very good. Then protection and maintaining immune system. Okay. It's very good. Very good. Okay. Thank you. Thank you for your contributions. So as you all said, reabsorb excess interstitial fluid. This is one of the major function of lymphatic system. So because wherever that lymphatic fluids is leak in the interstitial space, that lymphatic capillaries will be absorbing the fluid, the lymphatic fluid from the interstitial space, because that is why that is directly from there it goes to the lymphatic vessels and then lymph nodes. Through that lymph nodes, it goes to the subclavian vein. So it goes to the our circulation. No, so because of that, our capillaries, the lymphatic capillaries works well. That our fluid management, that fluid wall maintenance of fluid volume is maintaining well. Here, the second one is transport dietary lipids. Here, as one of you mentioned, Shiny said, the another role of the lymphatic system is to absorb lipids, especially in the intestine. I'll come to you later about that. And lymphocyte development and the immune response. So if these functions, if there is any problem in the lymphatic system, these all functions will be affected. Okay, so that is why we need to understand that what are the major functions of lymphatic system. So we all know that this is the system, this is our systemic circulation. So upper part of the body and lower part of the, you can just see that picture, and our upper part of the body, that deoxygenated blood will be collected through superior vena cava and it goes to the right atrium, and then what happened, then it goes to the right and left lungs. From the right atrium, it goes to the right ventricle. From the right ventricle, with the help of pulmonary artery, it goes to the lungs for purifying the blood. Okay, so you can just see that purification is happening into the lungs. There is a arterial and the venous capillaries are communicating together. Okay, so there is a communication between the venous capillaries and the arterial capillaries is there in the lungs also. Okay, so again for the lower limbs also, that inferior vena cava collected the deoxygenated blood from the lower part of the body. Again the same function, it goes to the lungs and then purification is happened. Here also you can just see that image. Upper part of the body and lower part of the body, that arteries and arteries and vena, the arterial and venous capillaries are communicating together. That there is a exchange is happening, that the blood will be exchanging together. Okay. So another thing is there is a venous system and the arterial system. So arteries, we all know that arteries are in the arteries. So the oxygenated blood will be that flowing, and then the venous system is deoxygenated blood. Here, you can just see the picture. There is a communication between the arterial capillaries and the venous capillaries are together in the tissues, in the interstitial space. So whenever the arterial and the venous capillaries are communicating together, there is a chance of leakage of fluid into the interstitial space. That fluid will be absorbed from the lymphatic capillaries. You can just see that greenish color. So that is the lymphatic capillaries. When the arterial capillaries and the venous capillaries are communicating together, there is a chance of oozing out the fluid into the interstitial space. Okay, everywhere. So that fluid will be absorbed by the lymphatic capillaries. Okay, so that is how that our tissues not getting edema. Wherever that fluid is formed, the lymphatic capillaries are absorbed. So what is lymphatic capillaries? So what is the structure of the lymphatic capillaries? It has a blind tinge, single layer of overlapping endothelial cells. You can just see that it's like a overlapping together. So this is how that's why that wherever the fluid is drained, that lymphatic capillary is suddenly absorbed from the interstitial space and more permeable than that of blood capillary. So this is more permeable. Okay. And lymphatic capillaries again lacteals. In our small intestine contains special types of lymphatic capillaries called lacteals. The lacteals pick up of not that interstitial fluid and also lipids. So lipid soluble vitamins. That is how that areas lipid, the lymph is look like a milky color, that is called chyle. So coming to the lymph node, from the lymphatic capillaries, that from the lymphatic capillaries absorb the lymph fluid from the interstitial space, and then it goes to the lymphatic vessels. Finally, it goes to the next, that fluid goes to the lymph nodes. Okay, again lymphatic vessels, and then it goes to the subclavian vein. Here, you have to understand that what is the structure of a lymph nodes. It's around 600 to 700 lymph nodes in our body. Just you can see that image, that there is a small, that round shape, the lymph nodes are visible everywhere. Okay, it's around 600 to 700 nodes in our body. So it looks like a small round or oval shape. It located along the pathways of lymph vessels. Okay, that in between the lymph vessels, the lymph nodes will be located, and length also 6 to 25 millimeters the length, and typically found in clusters, receive lymph fluid from the many regions, and also that you as I already said, all over the body. So body contains a lot of lymph nodes. So wherever the fluid is drained, the lymphatic capillary is absorbed and it goes to the lymphatic vessels. Again, it goes to the lymph nodes for filtrations. Again, it goes to the lymph vessels. Again, it goes to the lymph node. Finally, drain the circulatory system. How the lymphatic system works. So this is very, very important. We need to understand that how that lymphatic system works. So as I already said, the lymphatic system circulates protein-rich lymphatic fluid throughout the body. It contains bacteria, virus, and also the waste products. Okay, understand? So this is lymphatic system circulates the protein-rich fluid throughout the body, and also It contains bacteria, virus, and waste products. Then the next thing is the lymphatic system carries these lymph vessels, these fluid into the lymph vessels, which leads to lymph nodes. From the lymph vessels, it goes to the lymph nodes. For what? Why the lymphatic fluid goes to the lymph nodes? Just you need to understand, for filter out the harmful substance from the lymphatic fluid. That is why the fluid goes to the lymph node for filtration. From the lymph node, so that most of the bacteria and virus it will destroy, because we have that immune response in our lymph nodes. Definitely the lymph node will act against the bacteria and virus. Okay, then after that the waste flushed from the body and clean the lymphatic fluid drain into the bloodstream. So this is how the lymphatic system works. Okay. So as I already mentioned, from the interstitial space, the lymphatic capillaries will be absorbing the lymphatic fluids. From the lymphatic capillaries, it goes to the lymphatic vessels. From the lymphatic vessels, it goes to the lymph nodes for filtration, for filtering bacteria, virus, and other waste products. Then finally, it goes to the lymphatic vessels, lymphatic trunk, then collecting duct, and then finally go to the subclavian vein. Okay, so after filtering the waste from that lymphatic fluids, it goes to the subclavian vein. Okay, this is how our lymphatic system works. What is lymphedema? So now we understand that what are the functions of lymphedema and what is lymph, and what are the major parts of the lymphatic system, like lymphatic capillaries and lymph nodes, lymph vessels, and all. So these are the connecting pathway, connecting system, connecting pathway. They work together. So that is how our lymphatic system works fully. Here, if there is any damage, or any problem in our lymphatic system, so that lymphatic fluid not able to move independently. Understand? So it is a pathological accumulation of protein-rich lymphatic fluid into the interstitial tissue space due to an imbalance between the interstitial fluid production and the transportation. Okay, so but the fluid production will be always there. Okay, wherever the arterial and venous capillary is communicating together, definitely the fluid leakage will be there. So fluid production will be there, but the transportation will be affected, because if there is any damage in the lymphatic system, for example, just imagine a CA breast patient. So after diagnosing with CA carcinoma breast, definitely if there is if there is no metastasis, definitely they will underwent a surgery. So radical mastectomy, total radical mastectomy will be doing for removing the tumor. Okay, so when we remove the breast, along with the breast, we need to remove the adjacent lymph nodes. Okay, when we remove the adjacent lymph nodes, what happened? So in my left axilla, there is no lymph nodes. So my whole arm has a normal functions. The fluid, that collection will be there, but my lymph node is not working. There is a break. Okay, so there is a chance of accumulation of fluid in my upper limbs. Okay, got it. So there is a damage. If there is any damage or injury in any part of maybe as a major lymph node, so there is a chance of accumulation of fluid in that part. That is called lymphedema. Coming to the classification, according to the International Society of Lymphology, it says two different classification, primary and secondary. So primary is congenital lymphatic dysplasia. So from birth itself, there is a malformation of the lymphatic system. That is how that baby develop edema. So this is the that is the primary classification. The secondary is anatomical obliteration of the lymphatic system. So right now is normal. Tomorrow, is there any damage or any problem in your lymphatic system? You will be developing edema on that affected area. So that is the secondary lymphedema. Secondary lymphedema again divided into two, non-malignant and malignant. So non-malignant is trauma. So if there is any road traffic accident, major road traffic accident there, so there is a chance of damage of major lymph nodes. Sometimes inguinal nodes will be affecting. So that time that patients will gradually, person will develop edema on his lower arms, lower legs. So here we need to understand that non-malignant condition also develop edema, infections, recurrent infections, iatrogenic surgery and radiotherapy. So these are all the non-malignant conditions the patients can get edema. And malignant is primary lymphomas and secondary recurrence. Sometimes recurrence also, the one parts to another parts, maybe the cancer will be affecting the nearest that other part of the lymph node or any nearest area. That time also the that part will be blocked and the lymph is not move fully, and there is a chance of accumulation of fluid in that area. So how to diagnose? So we need to understand that there are situations, there are persons having edema on their lower limbs because of the renal problem, because of the pulmonary problem, because of the cardiac issues. So whenever you have seen a patient with that edema, you have to take a proper history. Is there an unknown cause? Is there any disease related or trauma related? Or is there any treatment related? So this is how we need to maybe based on your assessment, you will give a diagnosis. No, so here you need to do the proper assessment. After that, you can do the clinical examination. Okay, after you can take a detailed history, then you can move on to the clinical examination. So the first stage is pitting edema. Pitting edema is, so it looks like a orange peel skin. Okay, if you apply, if you have seen this kind of condition, if you have give your finger pressure on that area, your finger, that point, if your finger point is visible to you. Here you can able to visible that area. This is the pitting edema stage. This is the stage 1 lymphedema. Remember, you have to take a proper history. Then only you can do the physical examination. Then after you are taking the proper history, definitely you will get an idea why the patients will develop that edema, and then you can do the clinical examination also. This is stage 1. If you're not care the stage 1 lymphedema, then it goes to the lymph stage 2. So that is the stage 2 is the tissues have become fibrotic and hardened, and tissues are no longer soft. So this is the second stage lymphedema. The third stage is the tissues are considerably hard and cartilage formation will be there. So next is stemmer sign. So this is only one sign which you have seen in lymphedema patients. In a healthy person, you can able to fold your skin of that second toe, or for the upper limbs, you can able to lift up the fold of the skin on the middle finger. Okay, but in case of lymphedema, if the patient is having lymphedema on the lower limbs, you are not able to lift up the fold of the skin on over the proximal phalanx of the second toe. So that is called stemmer sign. Okay, inability to pick up the fold of skin over the proximal phalanx of the second toe. That is stemmer sign. This is present. So normally we can able to lift up the skin. For the upper limbs, you are not able, usually for a normal person, we can able to lift up our the skin fold on the middle finger, but in case of lymphedema, we can't lift up. What are the other diagnostic methodologies? So the first one is soft tissue imaging or MRI CT scan. So from this, you can able to determine the extra fluid volume. Okay. So, and the next thing is lymph vessel imaging. You can able to detect any abnormalities. Bioimpedance spectroscopy. Here also you can measure the interstitial fluid volume. So when you will do all these procedures, as I mentioned earlier, there are two different types of classification. One is primary and the another one is secondary. The primary, that lymphedema there, if there is any anatomical obliteration there, from the birth itself, you have to detect where there is any abnormalities, and you have to detect the extra volume. You have to assess the interstitial that measure the interstitial fluid volume and all. So from if that case, you can do these all procedures, use these all investigations. But in palliative care, we don't prefer these kind of investigation because these investigations are expensive. What we do is we usually take a proper history, and after that we will do the clinical examination. Then we will we will make a diagnosis, and then do the proper management. Coming to the problem. So here, there are a lot of problems will be there. Just imagine your one limb is normal, the another limb is too big. You are not able to carry. So you need a help all the time. So here, because of the fluid volume, the fluid, the absorption, the blockage, the blockage will be there, no? So then if there is, even if the blockage is there, but the production will be there. So because of that, the skin will stretch. So, and because of the fluid volume, the patients will get experience pain and discomfort, and also tightness will be there, heaviness will be there, because one limb is normal, the another one is too huge because of the fluid volume. So heaviness, fatigue will be there, and numbness will be there, impaired mobility. They are not able to move their limbs independently. They need help, and loss of functions. Because of that, they are not able to at least they are not able to do their self-care also. So that will be affecting the patients emotionally and psychologically. Coming to the psychological problems, psychosocial issues, body image. So one limb is normal and the other one is huge. So that will be affecting the patient emotionally, because nobody is willing to expose the affected limb in the public, because if they have seen, maybe in the public also, if they have seen this kind of the edematous hand, so they were looking into their face, and then ask them like, what happened? So what is your problem? Is there anything harm or any that kind of questions will be there, and also like they they are reluctant to move from into the community, and also they are reluctant to move to the public also, because of these kind of issues. So these all things will be affecting the patients emotionally, and also socially and spiritually. And loss of independence will be there. They will be that depending others all the time because of this disease condition, loss of change of employment because of this kind of that lymphedema, not able to work that previous jobs because the edema is huge, difficulty in wearing clothes and shoes, not able to, even if they want to wear a ready-made clothes, they are not able to. Anxiety and depression will be there. So what is going to be next? That they will be anxious all the time, and finally, if that they will be go to the depression too. Okay, so what you can do is, if whenever you have seen these kind of patients, if possible, you have to do the individual assessment. So individual assessment is the only the way to manage. So listen, you can manage these problems, and based on your assessment, you have to plan. So yeah, in front of the caregiver, sometimes they will not be telling the truth. So if possible, you can do the individual assessment. Then only they will explore all their concerns and worries with you. So then next one is social isolation. Society also, that the friends, or sometimes before that, before getting the diagnosis, maybe before diagnosis, the person has too many friends, and like maybe relatives also visiting a lot. But after getting this diagnosis, nobody is willing to see this person. So this might be affecting the patient a lot because of the misconception of disease sometimes. So social isolation will be there. So what you can do is, if you do the proper assessment, definitely you will get an idea. Is there any social isolation or any other emotional or any other spiritual issues there? So then try to maybe try to help them. So maybe if there is any misconception there, you can try to talk to them, and maybe you can talk to the relatives, caregivers too. So caregivers doesn't know, is there any that they might be thinking like, okay, this that disease will spreading to another person too. So this kind of misconception will be there. So better you can do the proper counseling and listening their worries. That way we can able to manage. And also constant reminder of disease. So we all know that because of the that lymphedema, that lymph node resection, because with surgery, that if you do the mastectomy, total mastectomy, along with that, so we usually remove the adjacent lymph nodes. Because of that, the person have developed edema on their upper limbs. But they might be thinking like, okay, my disease is spreading to my hands too. So these kind of things will be there. And also they will be thinking like, okay, because of my disease, my this edema will come. So all the disease, whenever they have seen this edema in their hands, they might be worried about that, because of my disease, I am getting these kind of problems. And management part. So now we learned about the lymphedema, what is lymphedema, what are the functions of lymphatic system, and what are the problems and all. So now we move on to the management. So how will you manage these kind of patients? If you have seen these kind of patients, how will you manage? Any idea? Anybody? So one lymph is huge. Now we understand that if there is any blockage or any surgical damage into the lymphatic system, there is a chance of accumulation of fluid in that limbs. So how will you manage? So they might need a diuretic to help drain the fluid. Okay. Then Liana said, any other answers? Exercise. Very good. Then elevate the swollen limb and encourage compression and stockings. Very good. Compression bandage. Okay. Any other answers? Diuretics and elevation. Okay. Thank you. Thank you for your answers. So as you all said, we can manage this edema. So with that, patient need a good skin care, because there is a chance of infection in that affected area. Because of that, we need to educate the patient about the skin care. So what are the important things they will look into? So that is important things. I'll come that part later. And then massage. So if possible, so just imagine a fluid is collecting in my left arm. Because of my damage, because of the damage of my left axillary lymph node, the lymphatic fluid is accumulated in my left arm. So what is our duty? So when the patients come to you with a left upper arm edema, so there is a block. There is a block in the axillary area. Okay. So our duty to push the fluid from that area to the normal area. Okay. Affected part to the congested area to the non-congested area. So just you can think about the affected arm. The lymphedema arm is the congested area, is the affected area. So non-congested area is the working part. So here our duty to push the fluid, massage the fluid, push the fluid from the lymphedema area to the non-affected side. Okay. So simple, there are two different types of massages there. Simple lymphatic drainage and the manual lymphatic drainage. So manual lymphatic drainage is one of the trained professionals will be doing the procedure. That's called manual lymphatic drainage. We all know that how much pressure is needed for massage. So that technique, medical professionals know. So, so that is manual lymphatic drainage. And the another one is simple lymphatic drainage. That is the you will before discharge. Sometimes they will be admitted in the hospital. So before discharge, we need to educate the patient and the caregivers about the management of lymphedema. So based on their knowledge, if you educate the patients, they can do some kind of exercise and some massages for that for the lymphedema part. So that is simple lymphatic drainage. So after that, after massage, you can apply compression bandages. You can apply correct bandages, and then after that you can do the exercise. So these are the ways, 4 ways to manage lymphedema. The first one is skin care, the second one is massage, third one is compression bandaging, the fourth one is exercise. And the another option is, another method is intermittent pneumatic compression pump. So so these are the way we can able to manage this edema. So before doing the massage, before doing the manual lymphatic drainage, you have to take a measurement. When we take the measurement, you have to take a both lymph measurement, because we don't know how much that lymph enlargement is there. So you have to take both lymph measurement. Always you have to give a comfortable position to the patient, and for the upper limbs, you can take a measurement from the head of the ulna plus 2 centimeter, then every 4 centimeter. From the head of the ulna plus 2 centimeter, then every 4 centimeter. Okay. For the lower limbs, you can take the angle from the angle joint plus 2 centimeter, then from there every 4 centimeter. Okay, for the lower limbs. This is, we have a video on that. I'll show you later. So that time you will get a full idea about that, how to take a measurement and all. So this is measurement is mandatory. So whenever you have seen a patient with lymphedema, before doing the management, you have to take a measurement. When we take measurement, you have to take a affected lymph and the non-affected lymph. Coming to the skin care part, always you have to tell the patient about to apply moisturizing cream. Okay, any cream they can apply. If they don't have any cream, they can use their own coconut oil or something. So always they can better they can apply moisturizing cream after bathing. Then in between the digits, that is very important, because the dirt is, because of the edema, there is a chance of dirt accumulated in between the digits. So if there is a dirt accumulated in between the digits, because of that, there is a fungal infection developed. So in between the digits also, they have to give a proper attention and avoid injections and venipuncture, because if you give an injection on that affected area, the lymphedema area, in case if there is any infection, maybe any infection develop, there is a chance of developing cellulitis, because there is no immune system is there, because lymph node is not working, lymph node is already damaged. So if you do this kind of procedure for that lymph, it will be affecting the patient. Okay, avoid roses. So again, there is a chance of damage on the skin, in the skin, and blood pressure cuffs also. Better you can take blood pressure on the non-affected limb, because it will be affecting the circulation too. And avoid injury. So if there is any injury happen, they can clean and keep that area. They can keep the area clean and dry. If there is any signs and symptoms of cellulitis, inflammation, so definitely they will go to the doctor and take a course of antibiotics. Otherwise, it will be affecting the whole arm. And also you have to tell the patient to take not take heavy weights. So if they are taking heavy weights, what happens? Again, the circulation will increase, and when the circulation increase, definitely the arterial and venous capillaries filtration is the capillary movements, that the arterial and venous capillaries communicating together, and again there is a chance of oozing out of more fluid into the interstitial space. Okay, so that is why avoid heavy weights, because if they take heavy weights, because of that, it will be developing edema more. So after giving a proper explanation for skin care, then you can do the massage. Here, as I already mentioned, there are two different types of massage: manual lymphatic drainage and the simple lymphatic drainage. So always you have to start with the deep diaphragmatic breathing. Okay, so deep abdominal breathing and stimulate the superficial lymph node. Example, neck, axilla, groin. So here, if possible, you have to stimulate. Take a deep breathing exercise. After that, you have to stimulate the superficial lymph nodes. Then you have to stimulate the unaffected side. So unaffected side axilla. If I am getting edema on my left arm, so you have to stimulate my right side axilla. My right side axilla is working. Is my right side axilla lymph node is working condition. So you have to stimulate the lymph node of my right axilla. Why we need to stimulate all those things? So if we stimulate the lymph nodes, the working lymph nodes, we are going to push the fluid from the affected area to the non-affected area. So that time good lymph nodes will be ready to take part of that absorb the fluid from the affected area. So it's our duty to push the fluid from the edematous area to the non-edematous area. Okay, so always you have to massage the proximal part to the proximal part first and then go to the distal part. Okay, so if there is an that edema here, you have to clear the fluid from the upper part first, proximal part first, and then go to the distal part and use gentle pressure only. So if you give a good pressure on, if you apply more pressure on that area, because of that blood circulation will increase. If the blood circulation will increase, definitely there is a chance of oozing out of more fluid. So there is a chance of again rebound edema will develop. So use gentle pressure. Now we are going to see a video on massage. Then we can move on to the exercise part, the bandaging part.
Management of lymphedema of the arm. Part 1. Manual lymphatic drainage or massage.
Thank you. I hope that procedure is good to everyone. I think you can just get an idea about how to give a massage and what is the aim of massage. So if you do the massage from this way, definitely we can able to reduce the edema. So our aim is to push the fluid from the edematous area to the non-edematous area. And before that, we need to make a pathway. So where to move, where to push, where you push, and we need to make a pathway. Then only we can able to push the fluid from the affected area to the non-affected area. So otherwise, that fluid will be there all the time. If you take a deep breathing exercise, definitely that all internal lymph nodes will be stimulated and they will be ready to receive the extra fluid, and that way we can able to reduce the edema. Okay, so before and after is deep breathing exercise is mandatory, because that will help to that reduce the edema fully. So after the massage, then you can do the bandaging part. So after massage, you can do the the bandaging. So before moving on the bandaging part, here we need to understand that what are the contraindications to manual lymphatic drainage. So if there is any acute cellulitis there, we can't do this massage. So if they have a cellulitis there, you have to give a course of antibiotics, and maybe if you're not able to prescribe, you can refer the patient to the physician and make sure that the patient is taking the antibiotics. So that way we can able to control, we can able to treat cellulitis. So the another thing is renal failure. So here, if they have a renal failure there, what we do usually, we push the fluid from the edematous area to the non-edematous area. So if they have the renal problem there is a chance of fluid overload. So that will be affecting the kidney again. So better if they have a renal problem there, better you cannot do this procedure. And then unstable hypertension. If there is any unstable hypertension there, again there's a chance of fluid overload. That time also you should avoid. Severe cardiac insufficiency, hepatic cirrhosis with that ascites, superior vena cava obstruction. So these are the contraindication. Here also superior vena cava obstruction also. Again, there's a chance of fluid overload that will be affecting the patient, that quality of life. So better these kind of that problems there, better you can avoid manual lymphatic drainage. Otherwise, you can do it. After massaging, you have to do the bandaging. So for the upper limb, what we usually do is we usually start with a spiral bandage. So you can give a spiral bandaging first, and then so make sure maybe after 2 weeks you can do the follow. Whether they have you have to see whether they are able to tolerate that bandage. If they are able to tolerate the spiral bandage, then you can move on to the that figure of 8 bandage, that is multi-layer bandage, figure of 8 or multi-layer bandage. Our aim is to push the fluid because of the compression bandage. That fluid, extra fluid will moves up. So that is how that is why we apply multi-layer bandage. Okay, so if after here upper limbs and lower limbs, you have to do the bandaging. If they have developed edema on the upper limbs, you have to do the same way only. First you can start with the spiral bandaging, and then go to the multi-layer bandaging. Again, the lower limbs also, if they have edema, you can start with, after massaging, you can start with the spiral bandaging, and then if they are tolerating with the spiral bandaging, then you can move on to the multi-layer bandaging. Okay. So after that, after bandaging, you can do some exercise, and you have to tell the patient about the elevation of limbs. So because when we do the massage, that most of the fluid will move up, and after that you will do the bandaging. Again, there is a chance fluid will start to move up, but if the limb is not elevated well, there is a chance of pulling of fluid and pulling the fluid in the lymphedema site always. So better they can elevate the limbs after the massaging and after massaging and bandaging. Here, exercise. What are the exercises you can educate them? So after doing the bandaging, so there is the pressure will be there. So that time, if you try to move the limbs, so there is that fluid will move that clearly, because already that the tissues will be compressing because of the multi-layer bandaging. Again, before that, you will do the massage. So here you can start with a low to moderate exercise. Heavy lifting and repetitive motion exercise also you can avoid. But you can do one thing, you can allow the patient to normal function, because it encourage them to do the that if they are able to do the exercise, you can encourage them. If they are not able to do the exercise, you can teach the caregivers about the importance of exercise and limb elevations. And when we do the when they are doing the exercise, one for their fingers, you can give a physiotherapy ball and ask them to squeeze it out. So that is that way we can able to reduce the edema from the fingers. And then they one for their wrist joints, one for their elbows, and the other one for their shoulders, so that all movements joints will be moved. And after the exercise they have to elevate the limbs fully. So because of after that, if you elevate the limb fully, so there is a chance of reducing the edema. Definitely that will that patients will get good relief with edema. So as I mentioned earlier, intermittent pneumatic compression pump. So this is another one of the another way of management. In case of stage 1 lymphedema there, then you can manage the lymph with the intermittent pneumatic compression pump. So there is a inflatable plastic garments. So you can that insert your affected lymph on that inflatable plastic garments. Because of the electrical air compression pump, like a BP apparatus, there is a continuous pressure will be there. We can able to set how much pressure is needed, 30 to 60 mm, usually 30 to 60 mm 5G pressure will be there. And duration also we can able to set 30 to 120 minutes. So here half an hour to 1.5 hours will be working continuously. If you do it, definitely because of this pressure, the extra fluids will move from the affected area to the non-affected area. That is how we give a continuous pressure on that area. If they are not able to do the, if this is quite an expensive machine, and also in maybe regional cancer centers, they have one or two machines like this. Better they can do the massage, their own hands massage, and that bandaging and exercise. That is the good way of management of lymphedema. And the another thing is stockings. Stocking is also they can use, but the thing is during the sleep time, night time, they have to remove the stockings. Otherwise, when the edema is reduced, the stockings will compress the tissues and it will be affecting the circulations. Better they have to remove the stockings during the sleep time. So there are two complications of lymphedema. One is cellulitis, and the another one is lymphoria. If they have a cellulitis there, we all know that what are the signs and symptoms of inflammation. Redness will be there, and the swelling will be there. Definitely pain will be there. That the heat will be there. These kind of signs and symptoms of inflammation be there. Definitely you have to think about the antibiotics and make sure that the patient is taking on course of antibiotic. The better antibiotics is amoxicillin. So you can tell the patient about the importance of taking antibiotics in case of cellulitis. And the another complication is lymphoria, oozing out of fluid, leakage of fluid from the lymphedema site. Again, the management is if they have a cellulitis there, you don't apply any bandage or massage on that affected area. But in case of lymphoria, again, here is because of the lymphedema, the leakage of fluid, the lymphatic fluid from the edematous that site. So that time you can apply bandaging. That scrub bandage is not contraindicated this condition. You can apply crep bandage. So that if you apply crep bandage on that time, definitely that extra fluid will come out. So these are the two complications. So we have one more video. I'll show you now, and then I have a small patient story, and I'll show you that. So we will discuss it.
Management of lymphedema of the arm. Part 2. Compression bandaging. Compression bandaging is layered bandaging of the affected limb to control swelling. It should be taught.
You all get some idea about the management of lymphedema. So now I'm going to share a patient story. Unfortunately, we couldn't get the patient story today. Can anyone please read it out? Anyone please read it out? Oyo boy, could you please read it out?
Hi, ma'am.
Yeah.
Okay, case scenario, Miss S, 50-year-old, female patient was diagnosed with carcinoma breast lip with lymph node metastasis about 1.5 years ago. She underwent modified radical mastectomy with axillary dissection followed by chemoradiation. She has been noticing that her left upper limb is progressively getting swollen for past 3 months. She feels it heavy and experiences pins and needle sensation along the whole limb. Questions. Letter A. What is the probable condition? Letter B. What are the possible causes for it in this patient? Letter C. How will you manage this patient?
Thank you. Thank you, Oyo boy, for
Welcome, ma'am.
reading out this patient story. So let me discuss. Anyway, this is a small patient story. If you have seen this kind of patient, so 50-year-old woman diagnosed with the carcinoma breast, coming to you with edema. So, what is your probable conditions? These conditions, what do you think? So, what do you think? So she has underwent modified radical mastectomy, and with if you do the modified radical mastectomy, definitely so axillary dissection will be there, and followed by chemotherapy and radiation has taken. So she has been noticed that her limbs, left upper limbs, is progressively getting swollen for past 3 months. Okay. Now she feels it's heavy and experience pin and needle sensation along the whole leg. So what is the probable condition? What do you think? So I am waiting for your answers. So kindly switch on your video. So I want to see you all. Now we have learned about lymphedema. We have learned about primary and secondary classification of lymphedema. This is a patient who is having cancer, breast, and underwent a mastectomy, followed by taken chemotherapy and radiotherapy. And gradually she has developed edema on her upper limbs. Now she felt like heavy and pain. So what do you think? Lymphedema? Any other diagnosis? Any other diagnosis do you have? Please tell me your answers. If you have seen these kind of patients, what you will do? If a patients come to you with these complaints, how will you do? How will you manage? Definitely, they will come to you first. You are the nurses. You just imagine you are the OPD, outpatient department in charge nurse. They will come to you first. If you have seen this kind of patient, so how will you? What is your primary responsibility? How will you manage? Tell me your answers. We are all nurses. Unmute yourself and talk. From this silence, I am thinking like nobody is doing anything. You just seeing the patient and standing there. Is it right? If no, please answer. Why you are sitting like this? So what do you think? This patient has lymphedema or not? Shiny, what do you think? I am asking to you, Shiny. So Aditi said it is lymphedema. Any other answers? Tracy, what do you think? If you have listened the class, definitely you will give the answer. If you don't listen the class, you will not give the answer. If you are listening the class clearly, definitely you can able to answer. Yes. Okay. It is lymphedema. Okay. So thank you. Okay. So you all agree with this is lymphedema. So what are the possible causes of this patient? What are the possible causes? You just think like that, then only you can able to do the proper assessment. Okay. So when the patients come to you with these kind of complaints, definitely you have an idea with this. So what are the things? What are the contributing factors to develop lymphedema? So from this patient story, what are the problems? What are the possible causes of these patients is developing lymphedema? Tell me. Priya? Tell
Yes,
me
ma'am.
one cause, tell me this patient story, one cause, one of the possible cause of this patient to develop lymphedema.
Patient patient radical mastectomy, and after that followed by a chemo radiation.
Okay, so this patient, okay, thank you, Priya. This patient has underwent a radical mastectomy. If you do the radical mastectomy, along with that, we will do the the lymphedema, that axillary dissection also. We will remove the axillary nodes, the lymph node also. So if you do the total, if the patient underwent a total mastectomy, that is the one major cause for developing lymphedema for this patient. So after that, the patient is taking chemotherapy. Okay, and the another one is radiotherapy. So the radical mastectomy, radiation, and radiotherapy and chemotherapy. These are the three possible causes of this patient have developed lymphedema. Okay, how will you manage? How will you manage? You have to do the proper assessment. You have to do the clinical examination. You have to do after the measurement, definitely you will come to the diagnosis. Okay, you have to diagnose with lymphedema, then you have to do the proper management. Definitely, you have to take the measurement from the for the affected limb and the non-affected limb, and then you can do the massaging and exercise, massaging, bandaging, and exercise. And also you have to educate the patient on skin care. Okay, so this kind of patients you can definitely you can treat with massage, bandaging, and exercise. These are the four skin care. These are the 4 ways to manage this kind of edema. So this is very important. The nursing issue. This is one of the major nursing issues in palliative care. And also apply compression bandage here. So as I already mentioned, if they are able to, like a crepe bandage, if they are that edema is unilateral, then you can think about the stockings. Okay, the compression bandage like stockings. But during the sleep time, they have to remove the stockings. And also physiotherapy. Yeah, as you Bindu said, physiotherapy. So usually the physiotherapist also manage the lymphedema. They will do the massage, they will do the bandaging, they will do the exercise and all. So physiotherapist also is a trained professionals for doing the lymphedema management. Definitely, these are the 4 ways to manage the lymphedema. This is manageable. You have to give a proper education on skin care. You have to give a proper massaging. You have to give after massaging, you have to give proper bandaging. If the edema is unilateral, they can apply bandage stockings and exercise. So whenever they are doing the exercise, they need to apply stockings or the bandages. Okay, without bandaging, the exercise is not permissible. So you have to tell the patients for importance of wearing the compression bandaging before starting the exercise. Okay, anybody have any doubts? Any doubts? Total silence. No doubts. Okay. Kanchan Binja, are you there? Shindu, are you there? Gurpreet, are you there? Okay. So if you don't have any questions, we can wind up the